Welcome everyone to my first YouTube video. Today I'm going to talk a bit about universal healthcare. So those of you who are easily offended by things like math or facts or education in general might want to pick a different video to watch. Because I'm going to use all of those things and, I wouldn't want anybody to think I'm some ivory tower elitist sitting here in my living room. Now, the main topic, as I said, is universal health care. Some call it the public option, some Americans have elaborate names for it, like stealing and Satan's thing, I have no idea. But really, what it is it's quite common. Norway, Japan, the United Kingdom, Kuwait, Sweden, Bahrain, Brunei, Canada, the United Arab Emirates, Finland, Slovenia, Italy, Portugal, Cyprus, Spain, Iceland. I could go on and on and on. There's a lot fucking more that use either a public option, a single payer system, or a variation thereof. Now, Norway, for example, actually adopted a single payer system in 1912. Yep, 1912, 6 years before the First World War. 1912. 100 fucking years ago. I know you love to think that this is in some way harming the people of Norway, you Americans out there, so I did some checking. Life expectancy is actually over 80 years old in Norway, compared to over 59 years old in the United States, but still, actually slightly higher. They don't seem to be rationing their medicine. The average income, because of course, people with a socialist system must make far less money. The average income in Norway, 53,000 American dollars per year per person. The average income in the United States, 48,000. And that number is artificially inflated because of the sheer number of millionaires and billionaires you have. So they don't make much more money, and they live slightly longer. So I'm not really seeing the problem here. But it's more than money, right? You hear about these countries with the socialized medicine, they pay so much more in taxes on that money. That they have to spend way less money and they have way less fun money than the average American. Well, you're wrong about that too. And I'm going to use Canada as an example because that's where I am and that's the numbers I know. And I can give you concrete information. You'll actually find it below this video. You'll find all my numbers, all my math, and the links supporting that information. Now, here in Canada, we actually pay less than the average American, and I'm going to show you how. The difference comes in what we pay in taxes. Now, I'm going to compare single people, not families, and we're going to assume the Americans live in a state that has a zero, big goose egg, state income tax. Now, yep, that last assumption should really hurt my numbers, right? Now, according to the tax calculator you'll again find below, a Canadian making $50,000 per year pays about $9,000 in taxes. Now, an American making $15,000 per year pays about 15% in taxes. Again, you'll see a link below. Now, that's about $7,500. So that means the Canadian pays about $1,527 more every year for our taxes, assuming we're making $50,000 just like the average American. Now, that means that over the course of 12 months, we pay about $127.25 more every month. Just for the record, I'm considering the Canadian American dollars to be roughly equal here, considering they've been floating around parity for the last, 6 months. But if you want to make a big deal out of that, there's probably pennies that we could divide either way. Now, the average annual health care payment for a single person in the United States is $2,985. Now, that's the average. You divide that by 12 months, and that's an extra $248.75 a month. In simple terms, an American without health care will actually pay about $120 more a month for these services. An average American without health care will pay about $120 a month less than the average Canadian, but we've got healthcare and they don't. An average American with healthcare will actually pay $120 every month more than a Canadian. They will pay $250, give or take, every month for their healthcare, where a Canadian, yes, it's called taxes instead of healthcare insurance, pays $127. That's the difference. That's it. That's using the average plan for the average payment and the average person in both countries. It is actually cheaper for a universal public option. That's just math. That's not an opinion. That's how the numbers crunch down. You're paying too much. Now, one last thing. The whole America is different and it wouldn't work here. That's bullshit. It would work. Sure, you have more people to cover. I hear that argument all the time. You'd also have more people paying in. If Canada has 10 million people paying 10 million a month, and the US has 100 million people paying 100 million a month, proportionally it's the same amount per person. Again, it's basic math. Division. Now, the reason it won't work in the States, however, at the moment, is your politicians are too fucking stupid to do the math themselves or spend 15 minutes on Google, coupled with this insane idea by the few politicians who are smart enough to know it would work, but smart enough to know they're better off exploiting the other system, because you see, universal health care, there's no lobby for that. Universal health care, when it's in place, doesn't have all of these big corporations willing to fund campaigns to keep them in business, because it's the government. Now, this is also coupled with the absolutely batshit bonkers idea that helping another person is some kind of moral gray zone that should only happen if it doesn't cost you a fucking dime. Now, let me make one thing clear. Americans spent billions of dollars to invade Iraq. And even after they found no weapons of mass destruction, the general consensus was this was still a good thing to do, because you killed off Saddam Hussein, who was a brutal dictator. You realize that in all of Saddam Hussein's time in power, he killed an average of 32,000 people a year. Less than that in most years, much more than that in some. But overall average, 32,000 people a year. That's just over half of the number of people who die in the United States every year from pneumonia. Yes, pneumonia. The thing that absolutely everybody in the rest of the fucking world, okay, developed world, goes to a hospital, takes 3 pills, and gets over. Only people that should be dying from pneumonia should be geriatrics or people with weakened immune systems. There is no excuse for healthy people in a developed country to die from pneumonia. And more people every year in the United States die from that than Saddam Hussein killed. But removing him from power was a moral imperative that had to be done. But helping the 51,000 people dying every year from pneumonia in your own country, well, that might cost you an extra $120. Except it doesn't. It saves you $120. Seriously, what the fuck is the matter with you people? Alright, I'm done. Thanks for tuning in. I'll have another one later.